Now, let's get to the actual demo. Now I'm going to try to just move along and function as I normally would. So I come in, rest. If I hadn't already repositioned the arms, that's when I would do it now. Here, the primary symptomatic side is the right side. So I'm going to palpate, but if I'm picking what order to do things in, I'm going to work on the symptomatic side last. Work on the non-symptomatic side first. It's amazing how conditioned you get. So, like, I need this in my right pocket. That's how I use it, right? So I only will use like 1 or 2 pumps on the bottle. Now for lotion distribution, this is one where you can pick how you do it. Do you just distribute it on the area you're about to work? Or do you go broader and apply on a few areas? I tend to use this as a way to do kind of the more gentle, light touch stuff. As I work, in this case, I'm distributing the lotion across this whole side of the back. And with that, I'm going to do lighter, palm-based applications, incorporate some kneading.
See how his applying lotion looks like massage.
Right. Thank you, Sarah. But yes, that's where if you're going to do the stuff that's kind of flowy and just feel good, there's kind of a 2-hand thing that I'll sprinkle in. But what I'm really doing is getting the lotion spread. And with that, if I'm going to pick a particular point to incorporate my kneading, it's with it or right after it. The distributing of the lotion can be where the kneading happens, and then even as the lotion is starting to absorb and I have more drag, now I can incorporate that more. So there's the kneads. Now we've warmed up the superficial layer of tissue. Now we can go deeper, going into a glide. Now my positioning, can I be predominantly working perpendicular or across the table or on an angle to the table? My other arm, my non-working arm, is just going to find a comfortable place to sit. In this case, I'm going to sit my forearm, put my forearm between the scapula and the spine, and it's just going to sit there. But it's not doing any work. Only this arm is doing the work. And I go across. I'm still warming up the superficial layers, making sure that the superficial fascia and even a little bit the first layer of muscle have been warmed up. And then I'm going to sink in and confirm what the ideal pressure level is for this gland. And I'm going to sink in, and you tell me when the pressure is just right. Okay. No more, no less. Just right? Good. Now I try to like gauge that, and then I'll have to check in other body areas, but that gives me a pretty good sense. Now with that pressure check, now I've done a compression. See how it's just a static compression? With the static compression, I check in on pressure. Now I can confirm, okay, I'm gonna find that pressure again. That's about right. And now I'm gonna give it some force, change my stance, change the angle of my form so that it turns into a glide. So we glide across, then on an angle. Okay, cross, and on an angle. I'm going to take a step back, work my way to the thoracic area, lower ribs. Okay, I'll slow down and stop. See, things can start as a compression, turn into a glide, turn into a compression. So I can stop and go, but the application will feel seamless, right? I'm going to do a come in, pressure, too much, too little, okay. Here, step, See how slow? So my tendency for, if I'm able to go slow with the client, because she likes the more drag, I just do like 2 really good ones. Now, if I needed to with layers of tissue, one might be more superficial with the second layer, first or second layer muscle, then the next one would go deeper. But usually with the third layer, you'd have to get more targeted. Most of these bigger applications using a forearm, for example, will be about the first and second layer of muscles. Okay, now I come up. This is where it's just kind of like not breaking contact. Here, I grab the arm off to the side. That opens the space up. Regardless of how you have the arm starting out, I really suggest always bring it over to the side. It makes working in this scapular shoulder area so much easier. Here I come in, kind of set my stance, look for my biomechanics. Table might be just the tiniest bit low for demonstration purposes. But note my spine. I'm not here. I'm here. Okay. No pressure. Right there. Okay, I hold for a little while. And I'm going to kind of restart. Give it a bit more force. So watch my knee and my belly. Let my belly, I really feel like what helped me is I thought about my belly moving forward. And if I try to engage anything, it's like I try to push this heel down into the ground. This should never pick up. It should be down on the ground, but push that heel down, engage that glute. Step. Good. One more time. Here. There. Now my point of contact is already here, so incorporating some joint movement would be an option. I can re-drape, working on just the arm. Perfect place for kneading. Here. I have the sense that the amount of lotion I already had in my hands is enough. I don't need to apply more. So we're looking a little bit deeper. This is the best angle to start with. Most of the time, this is really actually all you need, because I can change my force. See how I stand, and though it looks like a knead, now it's more towards the elbow and just directly across. I can do the same thing going up towards the shoulder. So I use kneading here more and kind of turn it a bit into a glide. Okay, down to the forearm. This is the one place where downhill and working parallel to the table works. So this is one exception. I can't remember if there's more, but where I can start with some lighter gliding here, some kneading. Okay, left hand, push. With this, I mean I make this pull big. And switch. The best one I have here is using your forearm on their forearm. As much as possible using the forearm in areas is going to be the best way for you to save your hands and body. But here I start pretty close to the elbow. I hold with one hand underneath. So leg forward is the forearm that I'm going to use. And then I just sink in, pressure, tell me when it's just right. Right there, okay? And then redirect, turn it into a glide. See that pinky moving? I know I've joked about before, but you know you're doing good work, but when you need to start lightening your pressure is when the fingers start moving. You see the fingers start moving? That means I'm more on tendon. I need to lighten up. Don't squash. Less pressure, more pressure. You can put a lot of pressure here, but you need to be much lighter here. It's an example of muscle energy stuff. So we went from compression into a glide, and then I could ask the client to do a variety of wrist and hand movements, right? So I could say, go ahead and make a fist, and roll your wrist in a circle.
Oh,
That too much?
no, it's right here.
Okay.
Feel it through that finger.
Okay, open the fingers. Now wrist in a circle. See how it's different? Fingers flexed, wrist in a circle. Fingers extended, wrist in a circle. Good, let go. Now play the piano, just wiggle the fingers all over and relax. There's other movements you can incorporate, but you can do really good work by just slow, deep compression, all the movements you can think of. Soft fist works great for the palm. If I had have a thing that I add to this is I protect the thumb joint with my other hand. I just put my hand underneath in here. It's the opposite of this. This one goes underneath using my left hand. Now my right hand's gonna go underneath the thumb, and then my soft fist. That means that just allows me to have control as I push through these muscles in the pad of the thumb called the thenar groove. These fingers are just underneath. I can feel the other side of that thenar groove. And here is an example how I can create the impression of a twist, but I'm not doing this. Not twisting at my arm and shoulder. I'm not doing that. I'm setting and then kind of sinking in and letting as I sink in create the twist. My wrist and elbow and shoulder are static. A lot of fancy footwork. And done. Reset wherever is comfortable. Come back around. And restart. Caught myself. We've already moved the skin around in a sense, but I didn't want to apply too much lotion too fast. Here we go. I'm gonna warm everything up. Knees. And round. Need. Transition into a compression. Getting myself set. Sinking in. Pressure. Right there. Less pressure over here compared to the right side, the left side. The right side is more sensitive. And I'm gonna gauge that. Incorporating little rocking things is a way that you can kind of create a sense of flow. Right here, and again, giving it a little bit of a push in a direction. Pressure still good? It's hard for me in these spaces because I'm looking and talking, but most of the time I actually work with my eyes closed. I went across, perpendicular, now down on an angle towards the SI joint. Feeling a little thing. I want to check in if I think I feel something. Check in with them. Does that feel like something there?
Yeah, it's sharp.
Okay.
And I can feel it in my lower pelvis.
Okay. In a way that feels like it's helping or not?
I think helping.
Okay. It's a very nebulous term. People call it the good hurt, right? Or therapeutic threshold. A way that I can start sprinkling in some muscle energy things. I find a spot and I say, go ahead and move your pelvis. Just find a position that makes it feel a little bit better. Nice and slow. See if you can shift around and find somewhere that makes right where I'm pushing more comfortable. Once you find it, hold it there. Now I've shifted into a static compression while she does that. Did you find a spot?
Yeah.
And when she did it, I felt her breathing ease up. So that's positional release. You push on it, you push on the spot that hurts, they move, they make it feel better. Now move out, back to neutral. Did that change? Got better?
Lifting.
That was my treatment. Now across, on an angle, and I'm done. Move on. Take your victories and run away. My fingers are finding the erector spinae right by the spine, confirming where I want my pressure to be. Over glides there. Just watch that my shoulder here doesn't actually move. I am not doing this, right? My whole body is pulling this off. Okay, grabbing the arm here, open the space up, sink in, compression. I don't usually have to check in this much, but I'm just showing how you could just do a pressure check in for each area. Is that about right? A little bit more, is that good?
Good.
Okay. I found a thing. Instead of having active movement, I'm going to use passive movement. Can't see, but I'm just pushing the upper arm, making the shoulder rotate a little bit. That's creating some shear under where I'm pushing because I'm moving the scapula. But it's small, just tiny movements. Here, come back. This area was elevated. I know the upper trapezius, levator scapulae, all can contribute to the shoulder blade being elevated like I found it. So that's where, because of the anatomy awareness, I can focus my pressure to be a little bit more specific, right? Based on what I found. And that is the treatment. That little bit longer static compression on a specific area, that was it. Some good knees. Knees on a little bit of an angle. Knees on a bit of an angle. I do that instead of a glide. I just feel like it transitions a bit nicer. If you have to focus there, then we've practiced, you know, how to use a forearm and everything there too. You're coming through. Need. Really pay attention again to how my elbow is straight and my shoulder stays nice and still. Okay, my hand is going underneath the elbow, down the forearm, down the forearm, up. I push on the belly of the muscles here that opens the hand so I can get my fist where I need it to be. And then nice rhythmic compressions. It'll get easier and easier to find the nuances of using the fist and the forearm just the more you use it. Because you'll start actually having a better awareness of how do I position my knuckles, for example, so that they're where I want them to be. All right. Now this is the symptomatic side. Flow-wise, usually this would be where I start. And I'm gonna actually come around, just make contact, and here we go. Undrape, bend leg, hold. Quick confirmation that there's no hard end feel, but right there, a little bit limited. That's too much. So there's too little versus too much. This is internal hip rotation, that's external hip rotation. All right, I just marked that. Gluteus maximus. I found the sacrum. Just come over a good like couple inches. There's the greater trochanter. So right there in between. I have a nuance here. I set my body on an angle, so I'm pulling the glutes away from the low back a little bit. All right. Okay, pressure. Out there is good. And as soon as I'm pushing, the movement's already better. So I have to digest that. The stabilizing the pelvis somehow made the hip joint function better. That's gluteus maximus. If I turn my elbow from more horizontal to more vertical, I'm going to go from here to here as my point of contact. So this is new stuff. Gluteus maximus, gluteus medius. Here, elbow down, there. That should feel like a different spot. Okay. Now the deep lateral hip rotators. I find the greater trochanter. I can already feel it with my forearm. So I would already know I just need to come back over. Usually my forearm does this. Here, here, here. I find the greater trochanter. I want to be just posterior to it. And now I'm going to assume that this hip is the best version of an optimal normal. And anything I feel on the right side is wrong. That's my assessment, is just compare and contrast. The good side, I'm going to say, is my example of good. And then the bad side, I just try to discover through palpation and movement what is different. Knee flexion and extension, reset, little bit additional draping. Remember that because the hamstrings run, they split at the knee, but they actually run more medial. You don't have to worry about trying to apply too much pressure over here. Focus your attention on this distal half. I distribute the lotion on the whole leg. So that's how I tend to do it. I tend to apply lotion on all the areas of the limb I'm going to work on. My hand orientation so my fingers don't go where they're supposed to. You don't want your hands to ever go underneath the sheet if you can help it. So there's my needs. Need, 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 switch, need, need, need. And I have to be huge, right? Okay, come in. I hold the calf. I hold the lower leg. Bro, I got a twitch. I was gonna do my pressure check and I should have done it sooner. Okay, pressure, tell me that's just right. Okay. This knee, and then just restart. If you don't know what to do, shake it. Oscillation is very non-invasive, but it can really reduce muscle tone and get all the tissue slipping and sliding. So don't underestimate the power of the shake. Right here, I just grab the hamstrings as a group. I really want this to be a big movement, okay? Reason why I shifted here, and for the legs in particular, this is very valuable for all those reasons I could list again and again. But if the area is very sensitive, targeted pressure just might not be your best starting thing to do, right? So defer to this. I let that try to warm up everything. I mean, we've made everything slip and slide even down to the bone. Now I'm going to come in, and because of the sensitivity, I'm actually going to create some slack. I'm going to shorten the tissue, and then I'm going to push. Okay, pressure. Okay.
You go a little bit stronger.
Yeah, okay. I'm just going to go real slow. Now, instead of a glide, what I'm going to do is I'm going to lengthen, elongate the tissue under my arm. It'll create a bit of a glide underneath, but I'm going to stay more still and use joint movement. Now, working on the hamstrings in this position, like look at my shoulder angle, I'm a little bit twisted. It's not the most comfortable orientation. And I'm stuck with most of my force being on the lateral side. There's 3 hamstring muscles. The hamstrings as a group. So there's bicep femoris, which is the one I'm pushing on right now. That's the lateral one. But then there's 2 that are medial, semimembranosus and semitendinosus. Semitendinosus is on top of membranosus. Now I'm going to just leave that alone because I can do better work on the hamstrings and sideline. Okay, calves. Gonna cradle the calf, gastroc here, and do a nice glide. I'm mostly paying attention to just the lateral half because I'm gonna get the rest of it in sideline. You can see even in this orientation, although the table's a little bit low, I feel less crooked and I feel more comfortable. Working especially the hamstrings in prone can be a way that therapists really get twisted. Okay, feet. Now, we know the client said she loved relatively aggressive footwork, right? This one, I'm not going to do most of my foot massage in prone. If I was going to do more of this, it would look like this, but look at how much I have to reach to pull that off. So I can avoid it. I do not work on the feet in prone. I do, at least not with compressions. I'll do this. I grab the heel of the calcaneus, grab the first metatarsal, it comes down to make the big toe, and I do a push-pull. It's like a knead on the foot. I'll do it on that side. Then I can switch. It's a bit of a reach, but I can do it the other side too. Pushing this side of the heel and grab the 5th metatarsal and more and give it kind of a knead. Now I've swooped around, now I'm on the other side of the body. And redrape. So we found something with the knee. Hamstrings are sensitive. There's spots there for me to consider. And I'm looking at the hip. I'm applying just light pressure here. I'm not actually targeting glutes now, but what I'm doing is I'm stabilizing the pelvis so that when I do this joint movement, I'm feeling end range. So what's good is it looks like the hip range of motion is not that different on either side. So now I'm going to target pressure. Now the tone here is increased. I can just feel more changes in the muscle density as I move the joint through range. There's something here in this transitional point of going from like anatomical position, neutral to going into any kind of rotation pattern. There's a sense that the muscle fibers are having difficulty doing that. I just feel like a thicker, bandier part of tissue and some resistance. And then it frees up. Still isn't too free that way. I'm going to switch my angle down. Get on glute medius. I heard a breath and pressure. You okay? That a little bit better. Yeah. Feeling good. Rocking. Can use my forearm, right? Okay, deep lateral hip rotators. I'm just posterior to the greater trochanter. I'm looking for all 6 of the deep lateral hip rotators. The most famous one is piriformis. Then you have 2 gemelli, or gemellus. They start with a G. So gemellus inferior, gemellus superior, or you could say gemellus. Obturator internus and obturator externus. not too bad. And then quadratus femoris. Those are the 6. You've heard them once, you'll hear them again. Coming to the hamstrings, bicep femoris, semimembranosus, semitendinosus. Now you've heard that 2 times. Hey, knees. Knees as a way to distribute the lotion and to warm up the superficial layer. Voila. Okay, coming in, the forearm. You can move the sheet a little bit. His hand can just rest on their body and the forearm can pivot. Don't try to just hold your hand up like that. Pressure.
Yeah.
That's how I pull off a glide here. Then another glide. And then I move on. All of this you're seeing is actually me just getting in the right place. Making it feel like massage, but I'm setting my feet and I'm making sure I'm not too much on the fibula. Good. So gastrocnemius is the big superficial muscle here. It, along with the muscle that starts halfway down the bones. Gastrocnemius starts behind the knee. It functions at the knee, but then it comes all the way down to the Achilles tendon and works at the ankle too. Soleus starts halfway down, fuses with it as the Achilles, and also works at the ankle. So the ankle movements here are plantar flexion, dorsa flexion. There's even another muscle underneath of those called plantaris that all 3 become the Achilles tendon. Then underneath all those are muscles that come, they don't pass the knee, they only work at the foot and the ankle. They come down, they go past that bone, which is the bottom of the tibia, and they go down into the arch of the foot. So her pigeon-toed tendency is this, I'm exaggerating the distortion. So it's typically not as much about the Achilles, it's about those muscles. And those are hard to get to in this orientation. It'll be much easier for me to get to those in sideline. For the muscles on the back, underneath there, so gastroc, soleus, plantaris, take all those off. Then you have muscles that parallel your, what people think of their shin muscles. There's a tibialis anterior, a tibialis posterior, an extensor digitorum, all the digits, an extensor on this side, extensor digitorum longus, on this side, a flexor digitorum longus. On the anterior side, an extensor hallucis. If you hear hallucis, it means the big toe. Extensor hallucis. On this side, flexor hallucis. So you learn one side, you've learned both sides. Swoop around. Knead. And there we go. I do this as some kind of transitional thing. I can't remember exactly where it comes from. I think it's chakra balancing, something like that. But over the sheet, heels, knees, low back, mid back, upper back, there.